Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Subspecializing in foot and ankle, we're having a tendency to see that becoming amongst our clients a subspecialty that's kind of growing. And so we will talk about things relative to them also today. What we want to just do is go through a general talk about podiatry coding and billing, hopefully give you some tips. I want to let you know that this is a little bit difficult to do due to the fact that there are so many local coverage decisions for CMS and Medicare that, that's why it is as general as it is. And I've given you the information. I've also given you a bunch of resources that I used for this presentation. But I strongly encourage you, if you are a Medicare provider, that you go ahead and look at your local carrier decisions relative to both your podiatry services as well as the DME services. Our particular Medicare carrier, WPS, and I'm in Illinois, we even have a list of CPT codes that they will accept from podiatrists. And that's going to be podiatrists specifically. And that's very helpful. The other thing here in the state of Illinois is that public aid or Medicaid currently is only covering foot services for podiatrists. They will not pay or reimburse anything performed in the ankle for a podiatrist, and just signed this week. They will no longer be paying for any podiatry services other than foot care services for diabetics effective July 1st of this year. So I have no idea what other states are doing, but just to let you know that that's what the state of Illinois is doing. So, we want to be aware of those things as things are changing and they're looking for places to cut services. This is, what we're experiencing here in Illinois, so you need to be paying close attention to that. So what we want to do today is talk about the general services, as I had said before. So some of these things will be relative to foot and ankle in general. However, I tried to focus on, the podiatry services themselves. So what I did was I never really knew what podiatry meant, and so I kind of went to the internet and our good friend, the Google, and looked at some of the things that are definitions or descriptions of podiatry that were out there. And as we know, it's the study, diagnosis, and treatment of disorders of the foot, ankle, leg, and lower back. Now, I never knew that podiatry included the leg and lower back. However, it makes some sense when we're talking about walking and, having a proper stance and whatnot and how that affects the back. Some other names that are used in other countries relative to a podiatrist is a podologist or a chiropodist. And so those are some other names you may see in other countries. In 2007, the Forbes magazine ranked podiatry as the 15th best paid profession. Now, I don't know exactly what the criteria was for that. I'm assuming that it was based on the hours worked, the liability, the how much they get paid actually per hour, the risk, and all of those kinds of things. I don't think it was probably just on monetary reimbursement. So, however, 15th best. And we know our podiatrists as DPMs, and again, we may have MDs and DOs that are also subspecializing in the foot and ankle. Now, it's very important that you look at your scope of practice allowed for podiatry. And each state is going to determine that. And I used Illinois as an example.
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.